LCSW test questions and answers with explanations. Practice exam 25 most asked questions. Question 1. A social worker in private practice is asked by a former client for a copy of their records. According to the NASW Code of Ethics, the social worker should provide the records immediately upon request, refuse the request to maintain confidentiality, provide access unless it would cause serious harm to the client, charge a fee before releasing the records. The NASW Code of Ethics states that workers should provide access unless it would cause harm. Question 2. A client tells a social worker they are planning to rob a local convenience store tonight. What should the social worker do first? Maintain confidentiality as no person is in danger. Report the threat to the police. Discuss the consequences of the action with the client. Refer the client to a support group. Social workers have a duty to report intended criminal acts involving harm, though specifics vary by state laws on duty to warn regarding property. Question 3. Which of the following is the primary mission of the social work profession? To provide therapy to individuals, to enhance human well-being and help meet basic human needs, to advocate for political change, to conduct research on social issues. The NASW Code of Ethics defines the primary mission as enhancing human well-being and helping meet basic needs. Question 4. A social worker is providing therapy to a child whose parents are in a bitter divorce. The father's attorney subpoenas the child's records. The social worker should first send the records to the attorney, consult with the child's mother, claim privilege and consult with legal counsel, ask the child for permission. Social workers should protect client privilege and seek legal/supervisory guidance before releasing records. Question 5. Which theory focuses on the goodness of fit between an individual and their environment? Psychodynamic theory, systems theory, ecological perspective, conflict theory. The ecological perspective emphasizes the person in environment and the fit between them. Question 6. The process of a client transferring feelings for a significant person from their past onto the social worker is countertransference, projection, transference, introjection. Transference occurs when clients redirect feelings for others to the therapist. Question 7. Which DSM-5 diagnosis is characterized by a persistent pattern of disregard for and violation of the rights of others? Borderline personality disorder, antisocial personality disorder, narcissistic personality disorder, avoidant personality disorder. Antisocial personality disorder is defined by a lack of regard for others' rights. Question 8. A social worker uses a strengths perspective when they focus on the client's diagnosis and pathology, the client's limitations and failures, the client's abilities, resources, and resilience, the client's childhood trauma. The strengths perspective focuses on assets and potential rather than deficits. Question 9. In the stages of change model, a client who is aware a problem exists but has not yet committed to taking action is in pre-contemplation, contemplation, preparation, action. Contemplation is the stage where the individual is considering change but is ambivalent. Question 10. A social worker should avoid dual relationships because they are illegal in all states, always lead to sexual misconduct, can impair professional judgment and risk exploitation, are too time-consuming. The primary concern with dual relationships is the potential for conflict of interest and harm to the client. Question 11. Which of the following is an example of self-determination? The social worker choosing the client's goals, the client deciding which treatment path to follow, the court ordering a specific treatment, a family member deciding the client needs help. Self-determination is the principle that clients have the right to make their own choices. Question 12. The biopsychosocial assessment is used to diagnose medical conditions only, evaluate the client's insurance coverage, understand the client through multiple lenses of their life, determine the social worker's fee. The biopsychosocial model examines biological, psychological, and social factors affecting an individual. Question 13. When a social worker feels an emotional reaction to a client based on the social worker's own past, it is called transference, countertransference, empathy, sympathy. Countertransference is the therapist's emotional reaction to the client. Question 14. A client with a history of alcohol abuse hasn't had a drink in 6 months but is now experiencing high stress. The social worker should first focus on relapse prevention, childhood trauma, finding a new job, marital issues. Addressing the immediate risk of relapse is a priority in substance abuse cases. Question 15. Which type of evaluation assesses the outcome of a program or intervention at its conclusion? Formative evaluation, summative evaluation, process evaluation, needs assessment. Summative evaluations measure the final results and effectiveness. Question 16. A genogram is used in social work to map out a client's financial history, visualize a family's history and relationships over generations, assess a client's cognitive functioning, track a client's medication usage. Genograms provide a visual representation of family structures and patterns. Question 17. The reframing technique in CBT involves giving the client a new set of rules, helping the client see a situation from a different, more positive perspective, ignoring the client's negative thoughts, forcing the client to change their behavior. Reframing helps clients interpret events in more constructive ways. Question 18. According to the NASW, when should a social worker terminate services with a client? When the client can no longer pay, when services are no longer required or no longer serve the client's needs, when the social worker finds a better job, when the client disagrees with the social worker. Termination should happen when professional goals are met or services are no longer beneficial. Question 19. Cultural competence in social work practice involves treating everyone the same regardless of background, understanding and respecting the diverse backgrounds of clients, forcing clients to assimilate to the majority culture, avoiding clients from different cultures. Cultural competence requires self-awareness and knowledge of other cultures. Question 20. The crisis intervention model is primarily focused on long-term personality change, restoring the client to their previous level of functioning, analyzing childhood dreams, conducting extensive research. Crisis intervention aims to stabilize and return the person to their pre-crisis state.